Hello, this is Dr. Guide. Today I have brought out some new equipment. It's a somewhat invasive device called Aporex, and if we talk about the equipment that used to be with it, there's Acascop, Venus, and recently Elsa, which are in cannula type. Whether it uses radio frequency, ultrasound, or laser methods to deliver energy inside, it assists with skin tightening and fat melting during liposuction. The recent trend is to use it in a way that feels like applying HIFU or Monopolar RF inside to reduce recovery time. Aporex is quite a unique device, so cast bet you use chance for some. First of all, it's Monopolar RF. It's a cannula type. And in the past, the biggest issue with liposuction and such was the cannula insertion point. Due to friction, the pH, and when melting the fat inside, there were drawbacks like too much energy going in or not enough energy, making it seem pointless. In this case, it can be seen as a device that has dramatically improved these side effects. First of all, the cannula insertion point can be done with an 18-gauge needle. It is coated, so no energy is transmitted to the cannula at the insertion point. Therefore, there was no need to prepare for burns or anything like that at the insertion point. And Monopolar RF. What equipment do we easily know as Monopolar RF? Shall we lightly talk about Monopolar RF first? Dr. Choi, it's the golden age of Monopolar RF these days. Starting with Thermage, there are many like Ultra, Tensorma, Sunny, and Serp. Thermage has been around for a long time. And there are now 11 or 12 types of domestic Monopolar RF. First, how does Monopolar RF work on the skin? Dr. Jung. So Monopolar emits energy from the tip which flows towards a patch attached to the back because a current called an amp flows. Then, which direction does the current flow? More energy flows towards the side that conducts electricity well. Since fat does not conduct well, it mostly goes towards the fibrotic septa, and initially this energy is delivered to the dermis. As it goes deeper inside, it exits through the fibrotic septa towards the back. So when we deliver energy, it is not to all tissues but only to specific areas. So, what's interesting is that these monopolar RF devices penetrate from the surface of the face. Starting from the epidermis, the current flows inside, and this is made with a cannula. So it goes in from the dermis like a filler cannula. It goes in from the subcutaneous and dermis, and according to the materials provided by the company, when applied on pork, the energy output is quite strong. And the concerns we have about side effects when using monopolar RF, because if the patch is not properly adhered, it can cause burns. And if there are metal parts on the body, the current flows and it can get hot, causing burns. In the end, the impedance checking is done very well. So if I lock it, the equipment automatically stops when it exceeds a certain impedance. And if it's set above a certain temperature, there is a temperature sensor. If it goes up, the equipment automatically reduces the energy. It's an interesting concept. So what purpose do you use this for? To melt fat or for tightening? You can use both. Originally, there is a handpiece for body fat suction equipment. It's usually used to liquefy fat for suction, but I don't prefer fat suction much these days. I use this concept by applying it very weakly as if doing monopolar RF from the inside. Then the risk of burns on the epidermis will almost disappear. Then this there are no burns, but rather the focus is on making the skin appear tightened by contracting the tissues inside. In addition to improving the skin itself when it sags, So, after trying this a lot, I found that even with a little more intensity, some swelling occurs. The energy is quite strong. Therefore, if you do it very lightly, the tightening effect is much greater than the effect of monopolar RF devices used externally, but it doesn't roughen the epidermis. The skin whitening effect is a bit less, but the tightening effect on sagging areas feels much stronger. Since I do a lot of thread lifting, I've been combining and specializing it with this, and I've been using it a lot recently.
These days, many people are using biostimulators and inserting them into the skin, but sometimes they are hardened nodules that form. Could this be effective for those as well?
In the case of PDL, Juve look, right? In this case, the hardening breaks at 60 degrees. But actually, now when it goes over 40 degrees, it's a 30-degree burn. When the surface goes over 40 degrees, the skin gets burned. So it's hard to apply 60 degrees inside, which is why we tried breaking those with HIFU. That goes up to 68 degrees now. Well, however, it's difficult to focus precisely and to align each shot. In this case, from the inside, If you hold it like a bovie on the isolation area, it feels like it's melting. But if you overdo it on the isolated parts, it can sometimes feel like a bomb has exploded as everything inside spreads out. However, it has enough merit for taking care of small, hardened areas. And as you can see in the video, the cannula is 18 gauge. It fits well into the hole made by the needles. There is no significant difference when using it with a 21 gauge cannula, so it's easy to perform the procedure, and although I haven't done many cases, I believe there's enough merit in using PBLIA to dissolve hardened areas.
There are existing cannula type lasers that deliver energy, and there are also ultrasound methods that melt fat, which have a melting sensation as they work. However, since this is monopolar, it might have a different feel.
But if the energy is strong, when you look a bit deeper, it feels like it's not melting, but rather applying heat by passing current. However, when you actually use it, the energy is so strong that even at 40 watts, which is the maximum of 60 watts, just holding it in one spot for 5 seconds causes swelling in that area. Simply put, the inside undergoes protein denaturation due to the heat. You can feel that. So it's like a very sharp knife-like tool, so it's better to use it lightly. Of course, if my goal is to completely dissolve fat or hardened areas on the face, then I can use it accordingly, but the recovery period would be long. I'm currently using it with the concept of an inside monopolar RF, and the results are quite satisfactory, better than I expected. And the good thing about this type of equipment is that there are no consumables, and the equipment cost is reasonable.
It seems to be one of the first monopolar devices that go inside.
The important thing is whether it is well implemented and the energy is effective. If there is maximum energy, usually weaker devices need to be set to the highest energy level, right? With this, even at half, if you hold it for about 5 seconds, so the protein denatures and you immediately feel the tissue hardening here, so there's a bit of a learning curve and it should be used lightly. However, I think it could be a valuable tool for practitioners who are very experienced with procedures. It also has significant advantages for treating sagging areas, jowls, and double chin liposuction. In my opinion, for those with thick fat layers on areas like the cheekbones, making them look angular, it's like sculpting the face. It's advantageous for that use, but the equipment used so far always had risks of pigmentation or hardening in the treated areas. That risk is zero. That's really good.
When I perform treatments, there are times when we need to fill, reduce, or tighten, and all are necessary, but the most difficult part is reducing. There aren't many cases where we can use suction, so I think it might be good to use it at those times.
These days, equipment seems to be getting more and more detailed. Even with the same equipment, it means that there are more parts we need to address and pay attention to for our patients. So today I talked about the cannula type monopolar Aporex, and our doctor guide will return with more good information next time. Thank you.